Hello, my name is Dr. Elliot Hirshorn. I'm a board-certified chiropractic neurologist, and I help people with chronic conditions to literally get their lives back. Today I want to talk to you about cholesterol. Cholesterol has really gotten a bad rap over the years, and I want to talk about whether or not cholesterol in and of itself is really a bad guy. Let's talk about a myth that cholesterol directly causes heart disease. We're going to talk about cholesterol and its impact on potential things like heart disease. And what I want you to realize is that 75% of people that have heart attacks actually have normal cholesterol. So there has to be something else that's impacting heart disease other than cholesterol. They've done studies that show that countries with higher levels of cholesterol actually have less heart disease. So that high cholesterol is not impacting heart disease in these other countries. There must be something else involved. And the statin drugs' benefits may actually be due to their ability to lower inflammation, not necessarily their ability to lower cholesterol. So we'll talk about inflammation in just a moment. So cholesterol, what is it? What does it do? Basically, we need cholesterol to function and to live. Your liver makes 75% of all the cholesterol that you have in your body. The rest of it comes from your diet. It's found in literally every cell in your body, and it helps to produce the membranes, the outer coverings of your cells. It's responsible for making vitamin D, for other hormones. It's also required for proper neurological function. So cholesterol is not a bad thing. It's extremely important for good health. What are the key players in this cholesterol picture? Number one, the things that we measure in the blood are lipoproteins called HDL and LDL. Maybe you've heard of those before. HDL is your good cholesterol, LDL is your bad cholesterol. Well, HDL and LDL, they're actually not cholesterol themselves. They are the carriers that take cholesterol to different places in the body. They're literally small packages of fat and protein, and the HDL will carry the cholesterol away from the arteries, so that's good. LDL carries cholesterol towards the arteries, and it allows it to build up. Another player in this story is something called triglycerides. These are very dangerous fats that are linked to heart disease and diabetes. Triglyceride levels tend to increase when you eat too many sugars and carbohydrates, when you're smoking, when you have inactivity, when you drink excessively, and when you're overweight. We tend to see these triglyceride levels rise. Now, how do these things interact with each other in regard to heart disease? The most important factors are not the total cholesterol. It's actually the levels of the HDL versus the LDL, the good and the bad cholesterol. The levels of triglycerides are also a key component of this as well. So what I look at is your total cholesterol to your good cholesterol ratio, and then even more importantly is your triglyceride to HDL ratio. I want to see your triglycerides down and your HDL going up. Too often we see in a lot of our chronically sick patients, we see very high triglycerides, very low HDL. My goal is to reverse that ratio. As we reverse that ratio, the research shows that we see a decrease in the risk for cardiovascular disease. Another key component is inflammation. Sugars and fats are also playing a key role as well. One type of fat, or the type of fat I should say, is more important than the quantity of the fat that you're eating. Omega-3 fats, for example, and monounsaturated fats are actually very good types of fats, and they improve the overall cholesterol status in your body. The biggest source of bad cholesterol is actually carbohydrates, things like sugars and refined grains. These actually drive your HDL, your good cholesterol, down, and they drive your bad cholesterol up. That's that ratio that I was talking about. What causes high triglycerides and low HDL, which is a predictor for cardiovascular disease? Sugars and refined grains. Another thing that that's a source of this is inflammation. So inflammation causes the buildup of small cholesterol particles, which are really the bad ones, on your artery walls, and that results in plaquing. Inflammatory markers that we look at to see if you have an underlying systemic inflammation that could predispose you to cardiovascular disease are things like C-reactive protein, homocysteine, ferritin, uric acid. These acute phase reactants are elevated when people have chronic inflammation and can be indicators for potential cardiovascular disease later on. So there's a multitude of different factors that are involved, so it's important that we look at a patient as a whole person, not just individual unique markers. So what we do for our patients, we evaluate you holistically. We're looking at a health history, lifestyle, hereditary nutritional factors, environmental risk factors. We evaluate all of our patients neurologically. We do blood analysis, urinalysis. We look at saliva tests, stool tests, urine tests, whatever is necessary for that particular patient Based on the results, we provide therapeutic support in the form of a customized program. Then we're looking at dietary changes, lifestyle changes. We're looking at nutritional supplements, gut health support, reduction of inflammatory triggers, and specific neurological rehabilitation. We help people with chronic conditions who are basically sick and tired of being sick and tired. If that sounds like you or someone you know and you want to get some more information about how we might be able to help you, just visit our website, renewingfunction.com, or call us at the office, 864-757-8500. Thanks for listening. Have a great day.